jump right into it. My name is David, and I'm here to talk to you guys about a few of the programs that I oversee here at HHHRC. The first of which being our statewide Ryan White program. And what the Ryan White program is a grant from the federal government that we manage in partnership with the Department of Health to provide people living with HIV critical medical care, social services, and supportive services. So what that kind of looks like is we help people kind of pay for their doctor's appointments, pay for their health insurance premium, pay for their medications. We are there to help people with case management services. We provide housing, we provide a food bank. So we really use this money as a way to kind of address the whole person for somebody who is living with HIV, because ultimately the goal is to get somebody into medical care and on treatment. But in order to get to that point, it's not always so easy. So we have kind of all these wraparound services to get them to that point where they're in a good place to start treatment and to be in medical care. So that's the Ryan White program, very simply. And then we have our law enforcement assisted diversion program, which is a really, really cool and exciting program that we're doing. It's a pilot that's based off of this program that started over in Seattle. And what LEAD is a program that is kind of like a partnership between us, community service providers, public safety officials, and law enforcement officials to divert people away from incarceration and into case management services. So kind of like the priority target population that we're looking at is people who are struggling with homelessness, with substance use, and with mental illness, because we want to kind of break that cycle of incarceration and that criminalization of these sort of things and really try to address people where they're at. And instead of, the police having either to arrest them or do nothing, we provide them with another tool that they can access. So it's a really cool program. There's a lot of really good results that we're seeing out of Seattle. So I would encourage you to kind of look it up if you do have a chance, because we're doing a lot of cool stuff with this. And then finally, the last program is our substance use pre-treatment services. And what we do with that is we do street-based outreach and care coordination to link people who are on the street struggling with substance use into substance use treatment services. And we're kind of the ones to help bridge that gap from the street into treatment. Regardless of their willingness to change at that moment, we'll kind of be there to meet them where they're at and try to help them along that path to substance use treatment.